What are the symptoms of cerebral palsy? Symptoms of cerebral palsy include problems with muscle tone, movement, balance, or coordination. In some infants, problems are evident soon after birth. In others, diagnosis comes in later infancy or toddlerhood.
In infants who are developing typically, we often see symmetric use of the arms and the legs. That's what we would typically expect to see. In a child who may be exhibiting signs or symptoms of cerebral palsy may show us asymmetry in their hand movements, in their arm movements, or in their leg movements.
Cerebral palsy symptoms in babies might include stiff limbs or low muscle tone, inability to use one side of the body, asymmetry, or when one side of the body moves differently than the other side.
If a child is not walking at about 12 or 18 months of age, we start to investigate why could that be? Are they still making progress toward that goal? We're looking to see whether or not they're crawling yet. And if they're crawling, does that crawling look appropriate and symmetric with good movement that is going to suggest that they'll be able to walk soon?
As a child grows, he or she might show additional symptoms of cerebral palsy, such as inability to hold up her head on her own, difficulty holding and using objects, clumsiness and frequent falling, losing previously acquired skills, toe walking, inability to sit on his own.
I think it's important to see a team for the diagnosis of cerebral palsy because lots of things can look like cerebral palsy but aren't cerebral palsy. And medicine in its very essence is just making sure you get the right diagnosis, do the right treatment.
Children who don't meet certain motor milestones or who have motor delays should be assessed for cerebral palsy. This is especially true for children who have conditions such as low tone, hydrocephalus or stroke, or who were born prematurely.
Things that we'll want to know about are motor milestones in particular, how they've been doing with something as simple as feeding or something as complex as starting to crawl and walk. There are many reasons for children to exhibit delays in their development. It's important for them to get in with their primary care provider, to have those motor delays investigated, and if the primary care provider feels that it's appropriate, then to refer to a center that can take a really good look at their child and give them some advice on how to move forward.
Because cerebral palsy is a collection of disorders, symptoms and effects range from mild to severe.
When we think about the child who has a more mild form of cerebral palsy, they're usually still able to make progress such that they will be walking. Many of those kids are going to walk on time, but walk with some asymmetry or a different walking pattern.
The most common concern we hear in the motor delay clinic is parents realize that there's something not right and they need to make sense of that so we can begin to help the child. Diagnosis is one thing, but at the end of the day, the parents just want to know what next, where do we go from here, and kind of what's the game plan.